Okay, I'm going to get started with a bit of an intro as people continue to join. So just for those who just joined, my name is Dulcie. I'm part of the DataKind UK team. Thank you for joining us this lunchtime. We're excited that so many other people are interested in this topic. We're going to be talking today a little bit about how data, particularly real-time or live data, can or can't be useful for policymaking. And I just want to thank the Insight Infrastructure team at JRF, Joseph Rowntree Foundation, for supporting this program. Their goal is to democratize access to high quality quantitative and qualitative data and evidence to help tackle injustice across the UK. And so this is part of that strand. And what prompted us to host this session at all was the observation that in the pandemic, we saw that real-time data can be really helpful for policymaking and then also kind of operational decision making as well. Adjusting public health support based on capacity. We've seen that there can be a bit of a push for more up-to-date data to influence decision making and policy. But we wanted to ask here, when is this level of detail, like when is real-time data and at what time scales is real-time data helpful for policy, particularly for sort of social policy? So we have a wonderful moderator who I'll introduce in a minute, and we have about 3 rounds of questions. We're going to have 15 minutes of time at the end for audience Q&A. So if you do have questions, please do pop them in the Q&A button or section of the webinar, and you're welcome to upvote other questions if you think that they're particularly excellent. You want to hear the answers to those. In terms of housekeeping, if you have any access needs or need any support, please feel free to message me or Nicole from the DataKind UK team in the chat, and we will do our best to help you out. And if you're just joining us, please, I invite you to introduce yourself in the chat, your name, what organization you're joining from. So with that, I am going to introduce our lovely moderator and then get started with the session. So our moderator today is Matt Whitaker, who is the CEO of PBE, formerly Pro Bono Economics. And so he's been at PBE since about 2019 and has been a founding member of the Law Family Commission on Civil Society, which is the research and policy program that was run through PBE that brings together public, private, and social sectors to help kind of unleash the potential of civil society. And PBE are, wonderful friends in the sector who support other third sector organizations with like pro bono economic support. And yeah, I'm really grateful to have his expertise and wisdom around data and policy today. So Matt, I'll pass to you and look forward to hearing from our panelists.
Thanks very much, Dulcie. Really pleased to be here. I was excited about this session before we started it, but I've had a look at who's in the audience. I'm even more excited now. Some really familiar names in there and big hitting names. So we're going to have a great conversation today, I think. I'm also really pleased that I get to be moderator because it means I don't have to pretend to be expert in any way whatsoever. Asking silly questions is literally the job description for today, so I can definitely do that, I think. And the good news is I am joined by 3 bona fide experts who can answer all of those tricky questions. So the hope is that we will have what feels like more of a conversation. I think the question is a really interesting and important one. It's one that I don't have a fixed view on myself. And from some of the pre-conversations we've had, I think there's definitely a good mixture of views across the panel. There will be views in the audience as well. So I think it's a really good one for us just to get our teeth into and explore a bit today. So I'm looking forward to it. In terms of who the panelists are, let's go through them one by one. We have Shamim Rahman, who's Deputy Director at the Department of Health and Social Care. She leads multidisciplinary teams using data to shape national policy on mental health, neurodiversity, women's health and maternity. I'm sure lots else besides. And Shamim is also a trustee at DataKind. You should know that. We have Dr. Emily Barker, who's Senior Policy Researcher at 4 in 10, which is the campaigning network that brings together 400 London organisations working to improve the lives of children living in poverty. And we have Dr. Emma Gordon, who's Director of the ADR UK Strategic Hub, which coordinates partnership between the admin data networks of the 4 UK nations and the ONS to improve access and analysis of admin data to inform policy decisions and ahead of joining ADR. Emma was also had senior positions at Treasury, the ONS, so she brings a great deal of experience in working with data. A great panel. I probably misintroduced several of them there, so I'll give them a chance to say a bit more about what they do in a second. As Dulcie said, we'll have sort of 3 rounds of prompts from me, I suppose, which will allow reflections from each of the panelists. And then we will get into audience Q&A as well. So do keep those questions coming in into the Q&A bit of the webinar, please. But just to kick things off, make it nice and simple, bit of context setting. Could I just ask each of you in turn to give me a bit of a sense of how you interact with data and policy? So you all come at this from different perspectives. You all make lots of use of data. You all have some interaction with policy in different ways. But it'd be really helpful for the audience and for me to get a sense of just what that looks like. And in particular, thinking about where is it in the sort of the policy framework, the policy spectrum, I suppose, that you tend to plug data in. And if you could use sort of any sort of specific examples, then all the better, please. Should we start with you, Shameen?
Yeah, sure. So thank you, everyone. Really excited to be here. So Matt introduced me briefly. So currently I'm working at the Department of Health and Social Care, and I lead a policy analysis division. So I lead data scientists, economists, social researchers, operational researchers, and statisticians. So data is a very core part of our job. And ultimately what we're doing in the areas that Matt mentioned, so mental health, neurodiversity, women's health and maternity, is we are doing the evidence, a large part of which is data, to inform national policy in those areas. And there are aspects to that in terms of ultimately having an impact on the lives of citizens, but also advising ministers, interacting with people with lived experience. The third sector is one of our big stakeholders, lots of charities in those areas that are very supportive and we work collaboratively with. So in terms of data, so also just to say I currently work in health, but I've worked in other government departments. So I'll try and bring some of the different examples throughout this session. I've worked in education, food safety, international development, and then I've also worked in the private sector. So it's been really interesting throughout my career to see the different applications of data and what an impact real-time data makes. So in terms of some examples, I guess I would split my role into sort of 3 bits. So the first bit is about before we roll out a policy, like how do we decide what policy to roll out and how effective it's going to be. And so data would come in there. Then there's a bit more around the once a policy is rolled out, maybe more on the operational side, like how are things going and what are the things that we want to do in real time to make sure that that policy is working. And then the third part, I guess, is a bit looking backwards, monitoring and evaluation. So just to give a bit of an example of each of those. So one of the ways that we used data, and I'm going to keep my examples more in the present. I did actually lead in lots of COVID work during the pandemic as well, which I can bring in later, where live data was just absolutely essential. But just concentrating on the present, one of the big things that we got was £1 billion of funding for mental health services in 2023 from Treasury. And that was really about setting the evidence base to show how mental health services basically have an impact on people staying in work. So the link between mental health and good work. And we use lots of data and evidence from international studies, longitudinal data, looking at sort of over time, because one of the things that Treasury is really interested in is durability of impact. So that it's kind of interesting there, where there's live data is good, but you really need long-term data there to show that impact. And then second things around the second example around where we're looking at data to like monitor things as they're happening. So we do quite a bit of surveillance. So things like safety issues, patient safety issues, where you might need more real-time data because you're sort of tracking what's happening on the ground in the NHS. So things like real-time surveillance, kind of early warning systems, and that's where live data becomes really important. And then the third one, which is monitoring and evaluation and looking back, I've led on. I am the senior responsible officer for the national evaluation of mental health support teams in schools. So that's quite a long-term piece of work, and we do mixed methods, qualitative and quantitative evaluation. And there you do collect data over a much longer period of time, and that's really important to have that much richer picture than just looking at what's what's going on immediately. Thanks.
Brilliant, brilliant. Thank you, Shalina. We could spend the whole session just talking through your experience of different bits of data. The inner nerd in me is sort of like itching to ask questions about it, but I'll resist and instead ask Emily for a quick sort of summary from you of the way in which, in your role, you use data and, in particular, plugging it into policy thinking.
Yeah, thank you. It's really nice to be here, and I'm excited to speak with the other panelists as well. I think we'll have a really good conversation. So as Matt explained, I work for London's Child Poverty Network. We're a campaigning and influencing organization, and we really rely on insight from our members. So we have between 400 and 500 members, and in general, these are small and medium VCS organizations across London. And so when we're looking at what data sets to explore and to use, what we're looking for is what are the policy issues, what are the drivers of child poverty in London. It's complicated, and so it's what indications is the data making around what the priorities should be for us in terms of influencing, and what are the particular challenges that our members are facing, and this can change. So I think where we're relying on kind of annual data numbers, oftentimes is things like child poverty statistics that can be broken down by borough that tell us how things have changed from year to year, but we do have to wait a year for those. And so when things change more quickly, there's a bit of a lag. On a quarterly basis, we rely on child poverty statistics around children in TA and how many children are living in temporary accommodation across London. And again, we can break that down by borough. But one of the challenges that we face, and we're really reliant on this data to kind of lead our campaigning work, is that they don't always overlap, and they create gaps, both in terms of time lag and then also what they don't capture. So, for example, the child poverty statistics that we have, they don't include children in TA, just the way that the survey is conducted. So this creates a challenge for us in terms of campaigning and influencing, because homelessness, and particularly children experiencing homelessness, is a huge problem in London. It's a key driver. But then when we're kind of making those arguments about child poverty and investment, those data sets don't align. And so we're trying to tell that story ourselves. So what's, I guess, interesting from our perspective is then we're reliant quite heavily on our members to fill in those gaps from more of that qualitative data, which it'll be interesting if we come back to that in terms of real-time data. Doesn't always have to be quantitative, but that we use that to fill in gaps about what on the ground is changing quite quickly, where the crisis kind of peaking on a really local level, and then adapting our influencing on that. So primarily, I would say we use government produced data as a first stop, but then we're looking to our members who collect their own data to kind of paint that picture a bit more clearly.
Great, thanks, Emily. That's you've raised a couple of different points there, which I think are really interesting for us to come back to. The sort of the qual versus quant point, I think, is a really interesting one. And I think there's something there as well, which I really want to pick back up with you later, around the extent to which timely data which is coming in from your members lands with policymakers. So do they believe it, basically? Or does the data have to have a sort of an official badge on it for it to cut the mustard? We'll come back to that. Emma, I'm keen to hear from you first. You've got a rich experience of using data and plugging it into policy, and particularly very novel ways in terms of the admin data stuff. So please tell us a bit about that.
Yeah, sure. So ADI UK programme was set up in 2018, initially as a pilot programme, because anyone who's ever worked on data sharing across government or access to administrative data as a researcher knows that this is hugely complex and tricky for lots of reasons. And so anyway, it was pilot phase first, and we're now coming towards the end of our first sort of full phase, and we've got funding for our next phase, what will take us up to April 2031. And the whole point of the ADI UK programme is to open up secure access to linked administrative data sets. So individual administrative data sets, whether it's education outcomes or health outcomes, it's relatively straightforward for researchers to get access to. What's difficult is getting permission to link it and doing all of that governance work up front so that researchers can get access to it in a timely way, because there's no funders won't fund a project if researchers are going to spend 2 years trying to negotiate access to data sets. So that was the problem that we were sort of charged with fixing. And we do this right across all 4 UK nations. And that's really, really important to us, because other programmes that have been set up to do this haven't really considered that data owners are a really, really important user of the outcomes of research. And given that all administrative data owners are essentially government data owners, we really wanted to set up a system where we were able to commission research that was going to be useful to each of the 4 UK governments, so that, yes, this data can be opened up for wider research use, curiosity-driven research that's driven by researchers, but absolutely those data owners and each of the 4 UK governments are getting that return on their investment in working with us. And we've got some really, really nice examples now of this right across the UK. So the Welsh Government have got a policy around supporting migrant integration, and they want to be taken seriously across the world as a nation of sanctuary for migrants who are at risk. And so they want to evaluate their policy, and they're doing that around assessing how migrants use public services, for example, GP services, in comparison to other people, to make sure that they feel properly supported and integrated into the Welsh population. And that work is published, it's on our website. Really, really interesting work. And in Scotland, there's loads of great examples coming out, but one really tangible one, everyone will remember that a few years ago, Scottish Government brought in a policy around the minimum price per unit of alcohol, because Scotland has a real problem with alcohol-related deaths and a real excess of these deaths. And they brought in this policy, and to ensure that it was valuable, you know, and to keep going with it, researchers did an evaluation of the policy to see if it had actually led to a reduction in alcohol-related harm, death, and it had. So that gave the Scottish Government the reassurance that they needed, that absolutely they should stick with this policy. And that policy is being monitored by many countries across the world as well as being really innovative. And in Northern Ireland, we've had some really, really interesting work done, because administrative data is every single member of society that has interacted with the service. You can drill down into really vulnerable populations that haven't been traditionally covered by, for example, survey data. And in Northern Ireland, we've done some fantastic work following up the experience of care leavers and the risk of homelessness compared to other people who haven't experienced care, being in care. And not surprisingly maybe, but quite shockingly, the risks of homelessness for people who've experienced care are massively higher than the general population, and particularly for individual sectors within those care experienced people. So it's not as bad if you're in kinship care, for example, compared to foster care. But again, knowing that, you can then do something about it in terms of policy intervention. And working with Ministry of Justice and Department for Education, UK government departments, we've done some incredible work linking education outcomes data to police national computer data. So we know every child that's got a conviction or a caution, and looking at who those children are and who is most at risk of being getting a custodial sentence. And again, care experienced children are hugely overrepresented in the children at risk of being sent to prison. And also, about 70% of the children that get a conviction or caution by the time they've left school have a special educational need. So are these vulnerable people that are being exploited or not supported in their education journey? And that's the outcome. And other work we're doing with Ministry of Justice, looking at the really, really high incidence of people that end up in prison that have a mental health condition, diagnosed mental health condition. And again, that's hugely high compared to the general population and compared to other countries as well. So really being able to look and thinking about prison as something that's really bad for the individual as an outcome and definitely one to be avoided, but also for society, because prisons are really expensive to run and all of the services around them. So if other services can be increased earlier on in a person's life, that means that outcome can be avoided, then that's good for everybody. But yeah, that's the kind of work we do, and really looking forward to this conversation. Thanks.
Yeah, thanks, Emma. If nothing else comes out of this webinar other than all the brilliant people who are listening in, check out ADR UK and start making some use of that data, then we will have done pretty well, because it's a phenomenal resource, and I'm really keen that more and more people get involved. I'm going to stick with you, actually, Emma, for the next round. So you've all given some really good examples there of the different ways in which you all use data. And to varying degrees, you've touched a little bit on data that might be quite timely versus data that's quite long term. But this session is about real-time data. So keen to get a sense from each of you as to the extent to which, sort of really real-time, timely, quick turnaround data is important in what you do. Whether or not whether it's you yourself using it or the demand that you see from others to have access to it, whether you've seen that change over recent years, and perhaps COVID was a sort of waterfall moment where things have shifted since then. And when we talk about real time, what do we actually mean? Are we talking about stuff that is being updated hourly, daily, weekly, monthly? There will be a range of different answers to that, I'm sure, but what does timely data look and feel like? Yeah, I'm going to throw back to you on that one, Emma, particularly I think from your perspective, that kind of like some of this admin data, if you can turn it around quickly enough, could be really sort of real time. So really interested to get a sense of how much appetite there is from researchers and others to actually make use of that data.
Yeah, sure. And you mentioned COVID, and I think that was the first time, certainly in my experience, that we'd really tried to make daily data available for research use. And everyone will remember the COVID dashboard and test and trace data and COVID infection survey data. All of that, we very quickly pivoted, all our data services to be able to make that kind of data available to researchers and policymakers. And obviously, it was incredibly important that monitoring over days and weeks, so you could test an intervention and test whether you had the right testing centres in the right locations. And some really early work done in Liverpool, was very good at pointing out that, where to put the test centres is actually incredibly important if you actually want people to go and get tested. And, the test centres were moved as a result of that. And I think in more kind of stable times, though, what researchers are telling us is, because of the sheer complexity of the data that we're making available for research use, one population level data set linked to another, and things like eChild, where you're linking decades worth of education outcomes data to decades worth of health data. That's over 700 data sets, data tables in its entirety. And just making sense of that, researchers need user guides, they need training courses, they need metadata information, and realistically, we can only aim to do that on an annual basis. And I say aim, we haven't yet got into a cycle of annual updates for each child. We're getting there with the data owners, and they're absolutely committed to that. But realistically, I think that's all we can hope for. But then, obviously, when you're looking at really detailed data on certain sections of society and population, you don't want to see the noise in the data. You do want to be able to analyse data over decades rather than days, I would argue. But really, really important that we can support daily updates in times of national crisis, if that makes sense.
Yeah, no, thanks, Emma. Just staying with you just for a second on that. So there's I think you've raised two things there. One is there is a sort of point of principle that in order to reduce the noise here, you need long-term data to sort of cut through variation that might just be noise, which makes a lot of sense. But then there is actually from a technical perspective, it takes time to turn this stuff around and you want to get it right. If you could wave a magic wand and do the technical stuff quicker, do you think there would be demand for that? Or is it actually just the case that people feel more like they're on firmer ground with sort of that longer term, slower data?
It's interesting, actually. I think in general, our researchers are okay with the longer term, slower data. If I go back to my ONS days when I was head of health analysis, we did the vast majority of our reporting was on an annual basis, because really you need to sense check, the current year's figures with the previous, sort of 5-10 years to make sure that you've done all the quality checks. There's nothing kind of weird coming through in the data that you haven't taken account of, and you really need to be able to report on that, get some feedback on that before you make the data available for wider research use. And you think about something like drug-related deaths, where all the time the team in ONS and the various statistical organisations in the devolved government will be looking to see if they have accounted for all the drug-related deaths, because there's new methods of dying by drugs, all the time, or so it does require quite a lot of quality control to make sure that, that all 4 nations have talked to each other and made sure they've got this right. Obviously, ONS produces, figures on the economy in a much quicker cycle. But again, there's that annual sense check of, now we've got the annual data, does that match what we thought on a quarterly basis or whatever? They don't always get that right. But, if you make the data available too quickly without doing those checks, then you risk just throwing a lot of noise there that then happens to, it's because the data wasn't quality assured properly. And this is really messy data. It's data just scraped straight off administrative systems that were never designed for research use. And we're learning all of the time how to do that quicker and in more scalable ways. But yeah, this is a long journey.
Great, thanks, Emma. That's really helpful. Shamim, coming to you, same question really, which is around this sort of, you've given us lots of examples of the way in which you've made use of data and make use of data, but can you think a bit about some of the more timely turnarounds? And there was a specific question I had prompted by what you were saying before, which is you sort of mentioned the evaluations that you run. I just wonder how, to Emma's point about noise and the trade-offs that are there, how much do politicians get that? Are they impatient for data now? Prove that this pilot has worked or it's failed, or I can cut the budget on this, or I can double down on that, or do they get that actually you've got to wait and I just can't, I can't force the data out?
So I have to be very careful how I answer that. I am a serving civil servant. But yeah, really interesting question. And I think that's the crux of what we deal with. And I think that really leads into what I wanted to say, Matt. Your question was very good, because I think what it's led by is, what is the question you're trying to answer? and that determines whether you need real-time data and what's the impact that you're trying to have. I don't think there's a one like fit for all answer about when live data is better than having much more long-term data. So I led on the shielding program during COVID, which some of you may remember, which was about the people who are most clinically extremely vulnerable, who are asked to stay indoors, and for quite a long period of time, quite a difficult policy for people. And their real-time data later helped us identify people in a different way. Initially, it was more about clinical conditions, and then we widened that using a risk modeling tool, collecting data as it was coming out on other factors like ethnicity, BMI, that affected people's risk. And then we were able to do a risk model that then identified who should be on the shielded patient list and therefore prioritized for vaccination. So that's a real example of where you start off in a pandemic with very messy or no data, and then you get to a much better solution when you start getting that nearer to real-time data. But coming back to the present, I think just that example of like, what is the question you're trying to answer? I think mortality data is really interesting, because mortality is such an important issue. It's somebody's loved one. It's, we want to keep mortality down as much as we can, where it's, for a reason that we can influence. But when we look at things like suicides data or maternal mortality, those numbers are quite small. Obviously, every death is something that we need to do something about. In terms of suicides in England, there's about over 5,000 a year. Maternal mortality is only 100 cases per year. So where you are looking at real-time surveillance, and we do it, we do near to real-time suicide surveillance now, where we are using, rather than relying on coroner's verdicts, which mean that the delay is, the data is really delayed. So it might be like a year or even a year and a half after somebody dies by suicide that it's confirmed that was a death by suicide. So the annual figures are lagged. We are looking we have started publishing, colleagues of mine in the department, working with the police forces around England, looking at other sort of warning systems. So the police will have, interactions where they are dealing with cases where it's a suspected suicide. And how do we use those for things like looking at trends, like are the methods of suicide changing? And what does that say? Are there particular locations around the country where there are more suicides? And there are particular, because of I guess the landscape, there might be particular suicides in particular areas, or whatever the method is, depends on what that area has for that method. So I think in those kind of situations, they both work together. You can't get rid of that really like robust data that does make sure that, it is, coroner has recorded it as a suicide, the method, the location, versus looking at trends. And I think when you have really small numbers, it's really important that you don't take like just a small change in pattern as indicative of something changing long term. So how do you look at those signals? And we do use a lot of other kind of expert experience, like benchmarking against other areas, for example, when we see a peak or a rise in something like maternal mortality, so that we're sense checking that and not making a rash decision on something that may not be a long-term trend.
That's really helpful, thank you. And just say a bit more on that for me. So it's a really sort of interesting example, and it sort of intuitively makes a lot of sense. But what then is the next step? I suppose you've got the data. You start to see that there's a let's say there's a peak in a particular part of the country, or as you say, a sort of change in the way in which people are doing it. You've got that backed up by some expert opinion. What then, in terms of the policy development? How much do you hang on it? Are you going to go after it really big at that stage?
Yeah, so I think there are definitely like safety checks. So you would have statistical models that kind of, do those. Well, this is showing us something. Then you would have the expert group. Then you would go. So if there's particular safety incidents in a particular trust, for example, then you would go to that trust and use their intelligence as well. So there are lots of different checks, but the key is to do that process quite quickly, so that you can get to the intervention. And then I think there's a learning process afterwards as well. Like, was that a right kind of alert, and what happened? And then do we keep that data point as something happened and there was an intervention, and then that changed something? Or do we kind of take that data point out? No, that wasn't actually a false warning. So I think it's a lot more complicated than just getting that getting that real-time data. And I realized I didn't answer your other question about our ministers, what are their appetites like. I will answer it. So I think ministers are very experienced and they are very practical. So they are very keen for real-time data, but they also do understand about investment. We do a lot of investment in longer-term research. I think generally, not specifically about ministers, I think any political cycle is always around a parliamentary cycle. And that is not to do with any particular politicians. I think generally the way that our democratic system is set up, things are according to that sort of 5-year cycle. So there is something around what is the data and evidence that you can get in a political term that does drive some things, but that is still quite a long period of time to be collecting data and to be producing evidence.
Thank you, and thank you for asking what was a loaded question. Emily, turning to you, I sort of said earlier that I was keen to follow up with you on this point about the extent to which the sort of insight that you're bringing and your members are bringing, which isn't necessarily a sort of an official annual data set, gets believed and has cut through. And I think, as Emma was talking before about the idea that real-time data is perhaps especially useful at moments of national crisis, the pandemic, and so on. But that we need more patient data for the sort of the more day-to-day operations. It strikes me that working on children's poverty, and lots of the people in the audience will be working on lots of other things which are really important. They can feel like crises at all times, and so actually there must be a lot of demand from your members for more timely data. And so I'm sort of mixing a couple of questions here, which is, what's the experience that you have on the sort of relative outside of the policymaker system of having cut through with the data and the insight in particular that you guys bring, and what sort of more timely data would you really want to have in order to be able to make a real difference to policymaking?
Yeah, both really good questions. I think that the meat of this answer actually comes from when you take things from a national perspective and you get really place-based and local. So in terms of, I think the trust and the relationship and the data sharing between our members and local policymakers and kind of local policy decisions, I think that trust is there, that the quality of the data when our members, really place-based organizations, are seeing things on the ground, are able to report back that they've had an uptick in a particular type of query or particular type of household crisis, and then passing that on to local authorities and other organizations, health and education, etc. I think there is actually a lot of trust. There's known names and faces that go with that. So then that data is valued, even though it hasn't gone through the high quality checks that other data sets would go through. But I think there's still a challenge in how much that can affect decisions given resources are so tight. So I'm thinking particularly when local authorities have to justify every penny that they spend, it's easier to do that when you've got a really, I guess, robust and kind of extensive, slow, kind of more traditional data set. When you've got more quick real-time kind of insight on the ground from local partners, I think that does help, but only when they've got discretionary funds to be able to respond to that. So the money does follow the policy, and I think that's important as far as what data is allowed to be trusted and used and acted upon. I think, I guess I'll give an example that comes to mind about where I think this would work really well if we could change it. Is childcare costs are the highest in London in the country, and they're a key driver of child poverty. And we did some work on this, and over the recent years, both the previous and current government have implemented expansion of childcare entitlements. And unsurprising to our members and people who've been working on early years for a long time, low-income households have the lowest take-up rate of these entitlements, quite significantly so. For families on universal credit, who have a preschool child, it's about 30% are using the childcare element, where if you look at the 3 and 4 year old entitlement across all working households, it jumps up to like 90%. You can break that down on a local level, and having that real-time data would be incredibly valuable to know which families in which areas are facing barriers and what those barriers are. And I know from speaking to local authorities that their teams do a lot of work to try to support families to take up those entitlements. But the process is both quick and slow. You've got to align your work with the code you receive, and then if it's not an intake month, then you've got to wait for the next term. So rapid data could actually be very, very helpful for our members to support families, working with local authorities, working with the childcare providers. But we see all that kind of pretty retrospectively, and it's kind of too late. And then the early years go by really quickly. So then these children miss out, and they're the children that we know would benefit the most from being in an early years setting. So that's just kind of one example. I think that while going back to the first question, I think trust is there, that if a kind of stay and play kind of early years charity sat down with their local authority and said, here's what we're seeing, we've got some data to share with you, I think that the local authorities I've met with would trust that and really value that. But in terms of actual policy implementation and what that looks like on the ground, we've got this mismatch that I think if we invested in using and partnering up a little bit better, we could see those committed funds from national government that are already there be used, reach the families that need it, if we could align that data sharing in real time a little bit better between VCS and local authorities. So I think there's potential, but it requires money.
As does everything in the end, doesn't it? Unfortunately, but I think that's really interesting, Emily. Thank you. I think there's a question that's sort of forming in my head. I'll try and ask it and see if it comes out in a coherent way. Which is, it goes back to what you said earlier about evidence data being qualitative as well as quantitative. And I have a bugbear. There'll be people on the call that have heard me say this a few times, a broken record, but that policymakers can sometimes hide behind evidence as an excuse when resources are tight and you can't do everything you want to do. And so we need better evidence. We need better evidence. You give them the better evidence, and they say, "Oh, no, we didn't mean we needed better evidence. We just meant we're not going to do this." And I wonder, therefore, if some of the real-time insight that you can bring, your members can bring, from a qualitative perspective, actually could have real importance, not in terms of changing the policy in the here and now, but feeding into those longer-term conversations that the policymakers will have when it comes to setting the strategy for the next 5 years. Because by seeing it in real time and hearing those stories, it might carry more weight than having data which you can say, it's not the most robust data, it's a bit out of date anyway, and we don't really believe it, and there's not much we can do with this anyway. But actually seeing human stories and that qualitative response can be much more powerful. Is there appetite from policymakers in London to hear that sort of stuff?
Yes and no. I think there's been various iterations of kind of different forums and different opportunities to feed in. And I think when speaking with and interviewing policymakers, both local at the GLA level and national, they're really keen to hear the stories that behind the quantitative data. They really are, and they respond. I've seen what we've shared with them reflect in their own statements and kind of priorities. So I think that is there, but I think there, maybe this slightly goes beyond the scope of the question, but I think the avenues for sharing perhaps could be improved, because when you're talking about qualitative data, if you've not got the resource to kind of write that up in a report where it feels a bit neat and tidy, it can just feel like you're kind of, what I've seen from members is that it feels like you're sharing the crises kind of endlessly. You're sharing these horrific stories or these frustrating experiences, and it's kind of, I think it can feel overwhelming as to what to do with that. And so even when it's in a format of a forum where there's an agenda and there's an expectation that these things would be shared, or when I've helped organize times where community members are sharing their own experiences that they've prepared, it is received, but I think there's an ongoing debate about how much should we act based on qualitative stories which are representative and emblematic of deeper issues. So we need both, but I think that what is beneficial about the qualitative data is that it can be quicker than the quantitative data. So if we can match them both up, then you've got that weight of kind of quality assured bigger data sets with those more emotive, frankly, but real-time experiences. So I think we need both of them, but I think we perhaps need to consider what those avenues are, because I think I have certainly been in formal forums and committees where it just feels like it gets a bit overwhelmingly depressing because the problems are so big and stories really draw at that emotion. So how do we kind of cut through that a little bit to the action part, while we're kind of waiting for those bigger data sets to confirm that what we already know to be true is true. Yeah, that a bit of the answer, but yeah.
No, that's a really good answer, because it was a incoherent question and a tricky one, but thank you. That's great. And actually it reflects, there's a comment that someone's posted into the chat about the sort of difference between data and research. So that sort of descriptive role of data versus actually what does this mean? What do you do with it? How do you fix it? So I think that's really helpful. That comment's in there. I noticed there's nothing yet in the Q&A. I'm going to do one more round of conversation with the panelists, and then I want to open up to Q&A. So please do, in the audience, post some questions in there, because no one wants to see me filling time later on. We've got brilliant people. We've already had a brilliant conversation. You will, I'm sure, have interesting questions that you want to pose to them, which they'll give you brilliant answers to. So do get those in. Before we do, let's do a final round, which is, I said this was going to be a conversation rather than a Q&A, and we've already definitely got into this final bit. So that's really helpful, which is this point about trade-offs. So we've sort of I think, Shamim, you gave a great answer last time around the sort of sense of slightly, it's horses for courses. What's the question you're actually trying to answer here, and therefore, do you want real-time data or not? There is obviously a trade-off between timeliness, accuracy, noise, as Emma's talked about. There are finite resources out there in the world generally, but in particular in data, statistical evidence building, and we have to pick our fights a little bit. So is there a danger, I'll pose a similar question to each of you, is there a danger that we get too caught up with real-time, a focus on real-time, that COVID has sort of unleashed something which there's more and more demand for this stuff? Even, there's somebody that has spent a lot of time analysing data over the last few years. The fact that all of the key economic ONS releases are at 7 in the morning now isn't very helpful to my life, and I'm not sure it really improves policy making. So is there a danger that we're going too far too fast on the real time? And if you had to make the choice sort of under duress between just getting the data right, getting it more quickly, or building more nuanced data, which one would you choose? I'm going to go to you, Shamim, first, Shamim.
Yeah, great question. So I think with not just now, obviously now AI is the big thing, but any time when technology is advancing and you're not advancing with it, you're in danger anyway. So I always have a very embrace what's happening mindset. And I think if we don't do real-time data, like it will be done in a way that isn't properly moderated, and somebody else will be sharing information out there. So that's really important. Just going back to the pandemic, when we were developing that risk model, we were worried that like if we didn't, we were working with the University of Oxford, some really clever people with lots of experience to build that. But if we didn't do it, somebody was just going to release a risk tool that you just plug your details in, and it gives you a risk factor for COVID, and then someone thinks that they're really at high risk, and that influences their behavior. And in the end, we got that registered as a medical device, which is the way it works, that risk tool. So I think there's something around, we do need people who have expertise, knowledge, experience to be tackling these things about like the thirst for real-time data. And if we don't do it, there's a risk of what happens if you don't do it. I think there's something around the ethics as well, that we've been thinking around with AI and real-time data. And is it inclusive, which is something we haven't talked about, which is really, really important. So when you get to collect data really quickly, what does that mean for whether you're getting a proper proportional representation of the population? But again, I think these are problems that we can tackle, and we should tackle. I don't think it's not necessarily that we should just throw the baby out with the bathwater, to use that expression. So I think real-time data, or the thirst and appetite for it, is here to stay. I do think we should invest in it. I don't think that should be at the expense of something else. I think in government it's really interesting because you're always making those decisions about what do we invest in. Allocative efficiency, for anyone who's an economist here, which is really difficult when every policy and every person matters. But unfortunately, with finite funding, you do have to make those decisions. So I think there's something around how do you, maybe there's a bit of an ethical moral dilemma for what do we invest in. There's also a practical thing, but yeah, it's a big question. But generally, I'm quite positive about embracing this, the need for real-time data.
Actually, Emma, to you.
Yeah, I think for me, it comes back to how simple or complex the data is. And the more simple it is, the more useful real-time data could be. And the more complex it is, the more quality assurance needs to go into that. And and sense checking that, and with linked data, you wouldn't need to understand the linkage quality as well, because if you don't understand that, you could well be reporting spurious research outcomes just based on an artifact of which data is linked and which data hasn't. So if I try and give you an example, just to bring this to life a bit, going back to my ONS days many years ago. So I'm sure they still do this, used to publish daily deaths. And that was just a count of how many deaths have been registered, and I think it was like 3 days before or something. So it's very straightforward for ONS to come up with that number. But that didn't include any information on causes of death, because as Shamin mentioned, if a death is referred to a coroner, then technically you're not going to find out the cause of death until the coroner has reported that finding. And the more complex the death, for example, if you're trying to ascertain whether it is a murder, then you're going to have to wait for the police to conclude their investigations. Somebody might have to go to court, for that decision to then trickle down to, yes, we can definitely say this was a murder, rather than an accidental death or something like that. So, and with drug-related deaths, ONS people literally need to read the outputs of any tests that were done to find out, the drugs that were mentioned that were in the system that might have contributed to the, so it's really, really complex stuff. So yes, if it's really simple and straightforward, and you can be confident that you're going to be accurately reporting something, then real time is absolutely fine. So number of people tested during COVID. Once you had the pipework set up to allow that, then you could give reasonably accurate data that didn't need constant sort of updates to make it more accurate. But yeah, the type of data we're making available, because you really, really need to do so much sense checking of the data and the linkage and make it research ready, you know, compared to just a dump off an administrative system. I think I'd be erring on the side of annual updates is a good place to be.
Thanks, Anna. Just while we've got you, just jumping ahead to the Q&A, because a couple of questions have been posed in there now, thanks to our audience members. And Rick raises this question, which I think is pretty similar to what you've just been saying, but maybe you can reflect on it, which is, what guidance would you give around making reliable causal conclusions from real-time data or real-time data connected with slower data? It's probably similar to what you just said, but have you got thoughts on that? Yeah,
really interesting, because making causal conclusions for administrative data is, yeah, inherently tricky. It's very easy to look at risk factors and you know, sort of, but making that leap to causality is very difficult. So I would, because the data that we're talking about is so complex, I'd err on the side that you need decades worth of data and a lot of linked information, you know. So even if you take a random variable like ethnicity, it's recorded in a lot of data sets, but in some data sets, we know the data quality is really bad. For example, in police national computer data, because it's essentially the recording officer, you know, sort of booking somebody into a cell, you know, and saying you're being held under this crime, blah, blah, blah. Somebody eyeballing the person in front of them that's deciding what ethnicity they are. There's 5 categories, and it's based on skin colour. That's it. Whereas something in the census, where it's self-reported and arguably not under, freely given, not under duress, you're much more likely to get more accurate data, and there's more categories. So, you know, a lot of reasons why, depending on what you're trying to sort of prove causality about, that quality of the data is incredibly important to understand up front.
Yeah, thanks, Emma. Emily, same question to you that I posed to the two, which is this point about, I'm being really cruel, I'm not letting you say it's a bit of everything. What do you and your members really want? Is it to know that the data that is being produced is actually accurate? You know, we've had all sorts of problems recently with data becoming less reliable. So is it accurate? Is it really nuanced, so it allows you to look in depth at particular parts of the population? Or is it really timely, so you can talk about what's going on here and now and react to crises as they pop up?
Yeah, it's such a mean question. I do think that, for speaking for our members in particular, I think more rapid data would be the priority, timely and triangulated. So what I mean by that is that the charity sector is such that you're funded to do what you're funded to do, and then if you're not funded to do that, you are often referring, and there's a lot of resource management that needs to take place. So I think if on a really local level, if you had rapid data that was telling you things like food bank use, things like rent increase, and applications to the local council for homelessness support, and potentially things like some information around schooling, absences, and related to mental health. If this data, while anonymized but really local, was available in a way where you could see an uptick more quickly, and I don't think it needs to be daily, I think it would be more monthly, but if you see that is a real asset for these organizations, because they are firefighting, they're always firefighting, and so for them to be able to engage with their local authorities that they're in partnership with, and to say, this is what we're seeing, and this is what we think might be behind it. Let's have a conversation about what we do now. I think there's real potential for that to shift into more long-term thinking. One of the challenges we face is we'll have lots of conversations with organizations, and the conclusion often is that we just need more funding for advice so that more people can access the existing services. And while that's absolutely true, it's kind of too late, because if they're already in crisis, and we've missed crucial months when these families needed help. So having that kind of data available, I think, makes those local partnerships more effective and helps design policy responses that prevent rather than only react. Obviously, if it comes to be that it's not very accurate, or it's there's questions about reliability, that will break down. But I think, given the choice, I think just more data available at a quicker pace would change how we spend the money on the ground.
Brilliant. That's a good answer to a tricky question. I'm going to ask you one more really tricky question, and then I'll let you off the hook on this, which is, whose responsibility should, you mentioned before, that it requires money, requires resourcing. Whose responsibility is that? Should it be funders within the charity sector supporting the organisations, the members of your organisation, to collaborate and produce better data, linked data, and so on? Or should it be the state and the local authorities investing in this stuff because actually it allows them to make better policy?
So I think we certainly need local government and national government to invest in this. This is their responsibility. That's what it is to govern. But I will make a case, actually, that funders should be investing more in this. We've seen more funders kind of expect their recipients to be networking, to be partnering, to be place-based, but you need resource around when and where and how, and that's data, to make those decisions. So I actually think that there's an opportunity for funders to step up, but it will require long-term investment. And this is where we need to see funders kind of make multi-year settlements with organizations to say, this isn't just 1 year that we're going to support you to set this up. We're gonna support a coalition of organizations, and we're going to do this for several years to really see the benefit and potentially long-term. And I will say, just to give a shout out to Trust for London, they've got data on their website that they invest in, and that they outsource different experts in, that we use all the time, and charities across London use it all the time, and it's excellent, and it's reliable, and it's updated, some of it more regularly than others, some of it annual, but some of it even more so. So there is examples of funders doing that, and I would say more of that.
I can't see the audience, Emily, but I can feel the weight of heads being nodded across the country. And you talk about funders investing in long term. Brilliant, thank you. Shamim, I'm going to come to you with the second question that's in the Q&A, if I may, because I think it's probably, you will be able to provide a really helpful perspective on this. And this is picking up what we were talking about before, which is the sort of tension between policymakers wanting evidence, but then when the evidence is presented, it's not quite the right evidence. And maybe that's because it's not the right evidence, or maybe it's because there are just some really difficult decisions to be made, and you have to have a reason in the end not to invest in something when you don't have the money to do it. How do we get around that? How do we create better connection between policymakers and evidence providers and people like Emily, so that we're having really open, honest conversations, and we're trying to deliver data and insight which actually makes a meaningful difference to your day-to-day job?
Yeah, it is, and it's a fair question. And I think I think that from both sides, maybe there's a bit of like, what is the other side doing? Like, we've got this great evidence and it should be taken to make a policy decision. We're trying to make a policy decision, and that's not quite, what we need to understand or make that policy decision. And vice versa, researchers are sometimes in academic research, things take so long by the time they publish something, it's sort of almost too late to make that policy decision. What we're trying to do, and particularly just speaking for myself and the department, is just trying to think of, in my area, mental health and clinical research, like an academic research or any kind of data. I'm saying I'm using research as a particular example of that. But how do you, right from the inception, make sure that it is going to be something that's going to have policy impact and not just for some other outcome, like being able to be published in a peer-reviewed journal, which is obviously sometimes what drives research, or what data you collect and things like that. So I think it's something around bringing together all the different people that have an investment here and thinking right from the beginning of the policy cycle of like, what is it that is going to be of value to invest in here? And it's still going to change because ultimately things happen. There are big safety issues. There's an attack, or there's a killing or something, and that becomes topical. And then, the evidence for that, and there's a public outcry. It's not just one way. It's driven by what the public actually wants. And then you need to get some quite rapid evidence to roll out some kind of policy intervention to tackle with that. So I don't think that will ever go away, but I think there is something we can improve in terms of the types of collaboration and conversations we have in the early policy making cycle that will try and reduce some of that. And I know it can be frustrating, and I do advise ministers directly on evidence, and I've never felt like I've had to make something up to try and get a policy through. And I do get asked this question on nights out as well: how much of your job is making stuff up to support a decision that's already been made? And I'm like, that actually, it's nice to be able to give this answer. I don't think it necessarily happens. They might say something, whoever is the decision maker, whether that's a minister or a policy maker, might decide to go down a different path because there's more than just the evidence that you're looking at. You're looking at what groups is it impacting, all sorts of things that come into a decision. But that's not because the evidence necessarily isn't believed or you're asked to make something up.
Perfect. That's a great answer. Thanks, Shamim. I'm going to, we're sort of coming towards the end. So, Emma, I'm going to ask you the same question about creating this better connection between evidence providers and policymakers, but also give you the opportunity to sort of give any final thoughts you might have. You think about the exam question for today was, when and why do we need real-time data for policymaking? So any final thoughts you've got on that bigger question, as well as the specifics of connecting policymakers and evidence providers?
Yeah, so I have to say, when I was an analyst working in ONS, so I was an academic researcher before that. So I had this idea that, you publish a paper and there's somebody in the civil service that's magically going to pluck this amazing insight out of the air and then develop a policy off the back of this one amazing piece of evidence. Of course that doesn't happen, and so from there I went into ONS, and again I had this naive idea that all policy decisions were based on evidence and we just needed to feed the evidence through. And then I went to Treasury, and I was in a job that was, really cross-cutting, supporting analysts right across government. And then it kind of slowly dawned on me that, ministers just need to make decisions all the time. Sometimes there's evidence, sometimes there's not. They need to keep making decisions. And it might be reactive because something's happened. You think of the prisons crisis and how to, maintain capacity or something. There might be evidence around what's the best thing to do. There might not. You're still going to have to make that decision because next day there's some more people that need to be sent to prison. And I think it's just the dawning reality of that meant that when I came into this job, I realized that, we needed to be constantly sort of linking researchers up with policymakers. So it's not a kind of one-off conversation or one-off piece of evidence that's ever going to lead to development of a policy. It's you set up those interactions so policymakers know who to reach out to when they want that evidence. And it's never going to be based on the back of, just an individual researcher. They want to sense check it that it's, meaningful across multiple different groups of researchers and things. And I think that's a massive part of our job. And there's also the policy making cycle. A politician isn't often going to wait for 2 years while an academic does a really in-depth study that they've directly commissioned before deciding. Because, like Shamima said, you know, we work on a 5-year electoral cycle. They get into office, they have to be turning around results really quickly. So it's what evidence is being generated on a kind of consistent basis that is going to be relevant to policymakers in the future, and it's having our sort of eyes alert to that and ears alert to that, and making sure that we're setting up those connections to react really quickly, I think. Thanks,
Emma. That's really good, powerful, and provides me with a bit of optimism. So, Emily, just final thoughts from you, and I'll ask it I'll frame it in that way, which is, are you optimistic? Do you think we'll crack this and we'll be able to have our cake and eat it and get timely data, which is good data?
Yeah, I am. I think that some of the conversations we've been having around the charity sector and AI and that enabling resource, I think is throwing up some really important debates about it, but really emphasizing the fact that there's a stronger relationship that's possible, and there's more interactions, and very much to Emma's point about the one-offs. The one-off of sharing information isn't what we need. It's much more about a relationship and ongoing conversations and feeling that we're working together to solve these problems at every level. So I do think that we can get there, and I think that setting up the infrastructure for some more rapid data is possible, and I think that there's appetite for it. I think the question is, who's going to own that? Who's going to take responsibility for that? And if we say we all are, then we have to still work out what that means in practice. Who takes responsibility for what aspects, and how do we build trust? So I absolutely think it's possible. We just got to keep talking to each other.
Great, thanks, everyone. Right, Shamima, we're in a good place. We're feeling good about ourselves. Last word from the panelists goes to you. Don't bring us down.
What would you like me to say? I think this has been a really great conversation. I think from our perspective, we have a lot of interactions. I guess we are the policymakers. So just hearing from the co-panelists, Emma, on all the great work that you're doing on linked data, Emily on sort of your membership and those views. I think there's a lot of power and like different perspectives, which is what I take away, and making sure that all the right voices about whether particular data or inclusivity of data, all those voices are heard in the room is really important.
Wonderful, perfect place to finish. Listen, to the three of you, thank you hugely. I've really enjoyed that. It's been a great conversation. I think you're right. We've learned a lot. And you filled me with optimism about if we keep talking, good things will happen. I'm going to hand back to Dulcie to close things out.
I just want to echo Matt's comments to say thank you to all of our wonderful panelists, and a big thank you to Matt as well for so adeptly facilitating that conversation and incorporating the Q&A for the audience. So thank you everyone for joining today. Thank you again to the Insight Infrastructure team for helping us facilitate this conversation. And we would be very grateful to everybody if you could please fill in our feedback survey so that we have some data. We do really look at it. If you found this conversation helpful or not, and if there's other topics that you'd like us to bring next year, we really welcome you to share that. It genuinely helps us shape our programs. So please do fill that out. And yeah, thank you again for joining us today. Big thank you to our panelists, and it was a really interesting discussion. Enjoy the rest of your afternoons.
Thanks all. Bye.
Thanks.
Thanks. Bye.